Well, thank you very much. Thanks for the introduction, and thanks for inviting me here today. So, for those of you who don't know, I've been very involved in the last number of years in developing medical applications. And medical apps, or apps in general, have really taken the world by storm. And I think that's how I was invited today, to speak to medical apps that really have the opportunity to optimize care. From a disclosure perspective, one of the pieces of software you're going to hear a lot about is from QXMD, where I am providing medical leadership and have an equity position. But my goal today is to, I hope, give you a couple insights on how you might improve your productivity in the work you do. Really try and be smarter in less time, but also go on a bit of a rant and talk about how I think that we do all need to contribute to apps. And I'm going to define apps in a way that maybe we're not all used to. Because I don't believe they're just programs that run on an iPhone or an Android device. So there's a lot of problems, I think, that we all face. As healthcare providers, we're overwhelmed by information. PubMed has more than 20 million publications in it. Every year, there's more publications than we could read in a lifetime. And yet, we want to provide best evidence. We want to provide best care for our patients. But it can be difficult to identify that content. It can be difficult to apply it at the point of care when you're with a patient. And I think that the trend in healthcare, which is a really good one, is that it's not volume that matters. It's the quality of care. It's the value we provide that really matters. But when you look at some of the tools we're given to do this work, it's a bit frustrating. So this is one of my favorite photographs. This was, I don't know, does anyone here use Meditech? Anyone here use Meditech? Who likes Meditech? Yeah, the hands are gone. So, when I go around, so I'm covering medicine right now. I do a bit of medicine too, and I have a list of patients, and I'd like to make sure I check up on those patients. And there's 12 easy steps for me to create my patient list, which are not easy. And just the other week, we lost a patient off our list, but we found them. But it really speaks to the fact that a lot of the tools that are given to us, they're not optimized for what we do. And the reason why I've gotten involved in medical apps, tools that run on smartphones, is because of the opportunity. Not that apps themselves are that great or that important, but it's an opportunity because we all have these little computers, or many of us do, have these little computers in our pockets, which can do so much. So really, the fact, this is US data, but about 80%, this is US physician data, about 80% of physicians in the US are using a smartphone as part of their daily practice. And if you look around the room, many of us are starting to do this. When we have a question, we pull out our phone, or we go to a tablet, or we go to a desktop, potentially. I'm going to tell you about a couple apps that I like, not in the interest of trying to be exhaustive, but really speak to what I think is important in a medical app. And although I'm going to talk about apps that do run on smartphones, I believe that any tool that's a productivity tool is an app. It's something that lets us do our job better and lets us think about the patient first. I think too many of the tools that we see built or that get thrust upon us focus first on the person who developed the organization, who purchased the system or built the system. Next, perhaps the payers. Perhaps after that, the end users, the clinicians, and very last, the patients. And I think we need to turn that paradigm on its head. It needs to completely reverse. And so when I look at a product like UpToDate, has anyone here used UpToDate? So lots of people in the room. I love this product. It's matured very, very nicely. I'm not going to take you through any overt demonstration except for maybe one. But I think many of you have used it. What I love about UpToDate is, for many of us, we're busy. We have limits to our knowledge. And it really allows us to recognize a deficit in our knowledge and very quickly, at the point of care, get access to a pretty succinct summary. And I think initially this was built by a physician in Boston as a physician tool, but it's really transformed itself into a tool that can, I think, bring almost anyone up to a reasonable level of expertise, quite quickly. A little tidbit for any of you who are at organizations that have an institutional subscription to UpToDate, you can get a free copy if you didn't know this. So talk to your local IT department, and if they have purchased an institutional subscription, you can get it on your personal phone for free. So I urge you to give it a try. But the principle with UpToDate is what they do well is they provide summaries. And I think our time is one of our most precious commodities. When I look about good productivity tools, I think those are tools that help us do things efficiently in a time-sensitive manner, because that's the one thing we all can't get more of is time in our day. And what we need to do is spend more time, I think, with our patients, helping them with whatever problems they're facing, not struggling to find the information we need. What I also like about UpToDate is that it is evidence-based, and perhaps more so now than ever. If you look back even 5, 7 years ago, UpToDate was probably a little more opinion-based than it should have been. And they've really, I think, revamped how they provide their summaries to actually make sure that all authors are adhering to the evidence and not purely their opinion of their own personal practice. What I also like about this product is that it's actionable, that it really gives you something you can do. And too many of the products I see out there are vague and are not actionable. When I look about drug databases, I mean, many of us will see a drug, not know what it is. Drugs are coming out every week, month, it seems. And certainly even the ones we know well have, there are challenges in knowing everything you need to know about a specific therapy. There's lots of databases out there, and I think ones that many of you have heard about are Hippocrates or Medscape's drug database. But I did want to bring up a tool that I love. I think it's great, and I would urge you to give it a try. It's a drug database called Micromedics. And what I like about this, one is that some sites do have institutional subscriptions, but if you don't, it's $2, so it's a pretty good deal. But it's very actionable, it's very concise, and it's very useful. How many people here have looked up a drug and you look at the side effects, and there's a list of about 47 items, and you're wondering, which of these apply to my patient? Well, the truth is probably most of those don't apply to your patient. And what Micromedics does is it really does a fantastic job of being actionable at the point of care, that they give recommendations which mean something. So they say there's a risk of an adverse event. These are adverse events that actually happen with some degree of frequency. Or if you look around through some of these tools, they'll actually give you educational tips. If you're teaching a patient about this therapy, you don't want to go through 47 potential side effects, most of which they never have any risk of getting. But it'll tell you this is what you need to tell the patient about in very simple, succinct terms. So again, a great product which is evidence-based, very brief, very concise, and very actionable at the point of care. Has anyone ever heard of FigureOne? Anyone in the room heard of this? Not seeing a lot of hands, very few hands. This is a product I would urge you to try. It is, who here has used Instagram? Am I the only one who's used Instagram? Or only one who will admit to it, I guess? Okay. So I'm on Instagram, follow me. FigureOne is sort of like the Instagram for healthcare. And when I first heard about this, I thought, this is the dumbest thing I've ever heard of. Why would I want to take pictures of necrotic lesions and post them for other people to see? But then I discovered something. This has become an amazingly powerful platform for learning, second opinions, and education and teaching. So I'd urge you to download it. It works on Android, works on the web, works on iOS. But what it lets you do, if you so desire, is, if you're just a layperson, lets you gawk at some of these, grotesque pictures or the things that are curiosities, which I suspect is probably 80% of the traffic they see. But for those of us in healthcare, I've discovered tremendous value. I had a case of a patient with a very unusual PD effluent coming out of them. I had never seen this before in my life. And I posted on FigureOne. And although most of the comments were ridiculous and unhelpful, there's this concept called crowdsourcing, where you look to large groups of individuals and ask them for data or information or advice or thoughts. And the rule is that as an individual, you might get a bad response, but on a collective level, you'll get an amazingly insightful response. And in fact, in this case, the accurate diagnosis in this case was presented by some individual I've never met and was upvoted by the community. And of the 20 responses I got to this posting, the #1 voted response turned out to be the correct answer. what we figured out after a couple days of workup with this patient. So it's a fascinating way to, I guess, engage with the community of healthcare providers, but also from an educational perspective. If you say, I want to learn more about nephrology, you can go in and type, click on the kidney button and see all these images, see all this discussion that ensues. And it's a really tremendous educational opportunity. And from a teaching perspective, this is an amazing teaching platform. If you see something and you're an expert or you know something about it that you think others don't know, you post it, you pose it as a question, request answers from the community, and you'd be amazed at the engagement you can receive. So I think it's an amazing tool that I would urge all of you to try. And now that I've gotten through the skepticism and shown that it can be valuable, please give it a try and see what you think. DrawMD, super interesting tool. I'm not going to show you a demo just because of some of the technical limitations of showing my iPad from this distance. But I put in a lot of PD catheters. A lot of us do a lot of things with our patients that we assume they know what we're about to do. That assumption is generally incorrect. We describe things, but we know that retention of what we say can be very, very low. And when you give someone a visual, a picture speaks 1,000 words, which is very true. This app is an amazing app which allows you, and it works on tablets, allows you to take some anatomical picture of an individual and draw out what you're going to do. If you're talking to a patient about a fistula, you can show them, what does this mean? It goes in your arm. Here's the arteries. Here's the veins. This is where the needles go. If you're going to put in a PD catheter, it's going to go below your belly button. There's going to be a small incision. Here's a tube hanging out. So it's a very powerful tool to provide a visual description to patients of what they have in mind. I'm going to tell you now a little bit of a project that I've been very involved in. For me, I'm very interested in knowledge translation, how we take information, how we disseminate it to the world community. So we built a platform to help people discover some of the best research that matters to them. And the name of the app is called READ. It's been a big area of focus for me, trying to create a personalized medical journal. So kind of like Zite or Flipboard, some of you may have used or may not have used. I don't believe the New England Journal of Medicine is the best journal in the world. Yes, it is one of the most highly ranked, and on average, the articles in there are outstanding. But when I look at a given issue of the New England Journal of Medicine, maybe one article is relevant to me in my practice. But there's so much in nephrology that I want to learn, and I don't have the time to hunt through hundreds of journals to find that content. So what we've been experimenting with is algorithmic curation, so that we can help people in the limited time that we have address the research that matters to them. We use something called native advertising to disseminate knowledge. We use tricks that Facebook and Twitter have used to inject content into the feed where you're looking, to work with partners who want to disseminate best practices for care. We did a really fantastic project with the BC Patient Safety and Quality Council and the BC Sepsis Network. Their challenge was to increase adherence to evidence-based guidelines in sepsis. They had a campaign running late last year and earlier this year called the 150 Lives in 150 Days campaign, ideally to improve quality of sepsis care. And we help them disseminate evidence guidelines to support sepsis care throughout British Columbia. We use a ton of data. I'm going to start talking a bit about data to understand exactly what happened. And as part of this campaign, this project believes that there was 151 lives saved over a very brief interval in this province. So although knowledge dissemination through apps was only a small piece of that, it's an incredibly powerful tool potentially to disseminate knowledge and change practice. If you look in one of the other apps we built called Calculate, we are able to take tools that are buried in research and admittedly sometimes hard to interpret and make them into very simple handheld tools that you can make decisions at the point of care. We talk about apps and productivity, and some of this has to do with knowledge, but some of this is about the work we need to do to look after the patients that we're responsible for. And I really do believe that a lot of the tools we use today are problematic. When you look at patient handover, and you look at the way we track the patients we're managing and communicate with one another about what's important, what needs to be done, what needs to be done today, some of our tools, who's used this piece of paper where you scratch down a few notes? and make sure you hand it over or call someone. I mean, it's not particularly productive. There's a really exciting product that I'm very interested in called Listrunner, and we're going to show you a quick demo of it.
It's 2 o'clock and you don't know who's following up on the CT scan and what's going on with the new admitted patient. Getting your whole team together again is a pain. What else can you do? Now there's Listrunner. Listrunner lets you run the list whenever you want, wherever you want. It gives everyone all the necessary case data all the time, synchronized and up to date on any mobile device. And it's got better security than the banks to protect both you and your patients. You're just a touch away from knowing exactly who's doing what and how far they've got. And handover is a breeze now that everything happening on the ward is in one place. No more paging or phoning to locate residents or interns. You won't waste time looking for info when you could be looking after patients. With Listrunner, your team is finally on the same page.
So what I love about this product is that it takes a problem in healthcare, which I don't think has been well solved, how we manage a group of patients and as a team collectively ensure we're not missing things, and creates I think, a really clever solution for how we potentially can address that gap. But what I want to shift gears and talk about in the last few minutes we have together is how do you build these products and how do we make sure they're actually useful? And I want to propose to you that it's our obligation as a medical community to make sure we choose the right products, but also iteratively improve upon them so they do serve our needs and they serve the needs of our patients. This app I was telling you about that we built called Read, I think if you haven't tried it, it's worth trying. I find it useful, and so do some other people. We've had tons of press and interest in what we're doing. Even Apple's identified it as a essential app for healthcare practitioners. But what's interesting is that, and this is actually not displaying that nicely with the glare, this is some of the analytics we look at when we look at utilization. But despite an active user base, we didn't see a ton of growth in terms of the engagement with medical knowledge. A baseline level, which was doing well, but not the growth we wanted. We wanted to see more people consuming more knowledge that was relevant to them. So we set out on a course to analyze data, create hypotheses, and test them to make sure that we were actually building a product that served end users. And we did that through data analytics. And so this is why I'm a big believer in medical apps. Not because it's any better than some of our physical tools, phone calls, pagers, what have you, but because they're measurable. And by doing this, we were actually able to change the course, the trajectory of engagement with this product to better achieve our aim of knowledge translation on a global scale. So for anyone who's signed up for Read, you'll find that depending on what you sign up for, if you say, I'm interested in peritoneal dialysis, you might get an email every week that tells you about new publications in peritoneal dialysis. If you're interested in vascular access, the same thing. But one of the things I discovered is that when you email people, most of us don't read our email. I don't read my email. If anyone tried to email me, I don't read my email. That's just the truth. But I sometimes do. And what I discovered is the little things matter. We do something called A/B testing. This is the internet word for randomized controlled trial. And probably originated in healthcare, but the world of digital media has adopted randomization and robust testing in a way that we would be so jealous of in healthcare. For those of you who do clinical trials, how long would it take you to put 10,000 people into a study, randomize them, and get meaningful results? Maybe a year or two of piloting and testing and grant application, another couple of years to run the study, and another 6 to 12 months to analyze it. With digital media, we can do the entire project in about a week. And so what we've done, we looked at our email and said, what should the subject line be in an email to make you want to open it and learn something? And so we found that through iteratively randomizing email subject lines, we've slowly taken an email open rate and click-through rate of about 20% and 2% respectively, and driven them to almost 60% and 9% respectively, simply by iteratively looking at the product, seeing what cues get people excited, what get them interested, modifying it very frequently through the use of data, hypothesis generation, and then change the end product so it gets better and better over time. We noticed that We sent out a lot of email, but the one that was getting the most engagement was when people pick keywords, topics that they're very interested in. So not surprising if someone says, I'm really interested in multiple sclerosis, they're probably going to read articles about multiple sclerosis if we find them for them algorithmically. These emails get an open rate of 85%, which is far in excess of the typical open rate of email, which is about 10%. And a click-through rate of about 13%, so about 13% of the time someone will actually read an article based on an algorithmic recommendation. And so we figured, well, if people like this stuff, we should make it easier for them to do it. So we thought, well, if someone's going into our app and searching for a topic, we should make it really, really easy for them to take a search that they ran once and convert that to a reminder on an ongoing basis about new research and new evidence in that therapeutic area. And so just by simply modifying how we offer reminders, we've seen a striking increase in engagement with the research around areas that people care about. So really, the focus here is on looking at the data and then creating a hypothesis, implementing that hypothesis, testing it, either through before-after comparisons or randomization when possible, and modifying products that get better and better. And this is what we should be asking of all the products we use on a day-to-day basis. We should be going back to Meditech and saying, I don't love it the way you've done this. What about trying it this way? And expect them to modify based on data, and not based on what the payers want, what the hospital wants, what the government wants, but what our patients and we need. And I think we have an obligation to advocate for this level of intervention and data analysis and modification. We had a really interesting phenomenon. For those of you who've signed up for one of our apps, we send out push notifications, which is that little buzz you get on your phone. So when something is very interesting, so we have algorithms that figure out that perhaps a certain article has garnered a lot of attention for people like you. But we also noticed that when the US government shut down back last December, PubMed shut down for a little while. There was no updates. And so since all of the data that flows through the application is driven from the PubMed database, we saw a lot less active user engagement. And it was based on this sort of natural history experiment where we saw, wow, when you don't send people reminders, they don't read stuff. So it clued into us that, well, this is something we should try. Maybe we craft this hypothesis. If we send people very targeted, personalized recommendations through a push notification, that's going to drive engagement. And again, we tested it. We saw a striking increase. And even the smallest things matter. When people go down to download an app, what takes you from seeing a home screen and then deciding to actually download and install it? Well, we discovered that even a very, very simple intervention of changing the color and text on a picture of a screen gave us an 11% bump in people who went from seeing an app that they might be interested in to actually downloading and starting to use it. The smallest things matter. On the website that we run, we want people to register, because if you come to the site and aren't logged in, it's not personalized. And the whole value proposition of this product is that it's very personalized and that it conforms to what you're interested in, what your practice is. And we thought, well, we used to have a button that said register. We thought, well, maybe that's a bit formal. Maybe we should say just sign up. Maybe that'll make a difference. So we use this really cool tool. It's called Optimizely. And it allows you to run a randomized controlled trial on your website and get really large numbers in a very small amount of time. So we said, well, what if we just randomly allocate our audience to sign up versus register buttons, see what happens? And what we saw in a very, very short period of time was a 30% increase in registration simply by changing one word on a page. Imagine if we looked at the medical tools that we're asked to use on a day-to-day basis, and we went through that iterative process of testing a ton of different options and seeing what worked. I had this other idea that maybe if we just change some terminology about reading the article, instead of saying read this article, we say read full text now. Would that make a difference? And again, we saw a huge bump in engagement of reading the research that matters to our patients, simply by just changing a couple lines on a page. And I really wonder if we had the opportunity to do the same things with the apps that we're asked to use in day-to-day practice. Imagine the impact on healthcare. Part of our platform is predicated on the idea that the community will provide insightful comments that everyone will learn from. We had a design flaw, I would say, where these comments were hidden off the side of the screen. You had to pull them over to read them. We just moved the location of where those comments were displayed from the side of the screen to the bottom of the screen, where people had finished reading an article abstract. And we found that after about 18 months of this app being out, used by the world, we made this modification, and 20% of all the comments we ever received came 14 days after our design change. A very, very small change, but made a huge, huge difference. So I'd really like to come back to the products we use today, our EMRs, our charts, and recognize that these are just apps. These are just tools. They don't have to be software. They can be physical tools. But the obligation, I think, is to iteratively take them, try to improve upon them using a real combination of both data and inspiration to drive that change. So I'm going to pause here and take questions from the audience. And I'll repeat the questions for anyone who has any, so the rest of the room can hear. There's a big glare, so I can't really see very well out there. So there's someone in the back,
I'm
please.
just wondering about the implications of using FigureOne and patient privacy with posting photos.
Yeah, so that's a great question. So FigureOne does require you to get patient consent. They actually provide a little consent form in the app if you want to use it, or you can use your own. They also have privacy protection in place. So for example, if you post a picture of a patient's face, the software will recognize it's a face and it'll block it out. And if, let's say, you post a picture of an arm and it has a distinctive tattoo, they have a software tool where you can actually physically rub out that tattoo. So anything that would make things personally identifiable, even with consent, they provide either automated or manual opportunities to make that private.
Question.
Oh, there's a question in the back there.
Hi, question. Sorry, how do you overcome, or what's your opinion on hospitals' no cell phone policies when we're trying to utilize these apps?
Yeah. Yeah, so I think it's ludicrous. I think that initially there were some concerns about interference with hospital equipment. That has turned out to be pretty much unfounded as a concern. You know, from a productivity perspective, you know, I'll go back to when I was in medical school. So I've always been interested in how technology can help us, and I was one of probably the first people to sign up for Medscape when it first launched. And I remember being at VGH and trying to get onto Medscape to look up. I had a sick patient. I was a third-year medical student, pretty terrified, didn't know what to do. And I was going on the computer, and I was locked out of the computer. And I called the IT department. I said, why can't I access the computer? They said, well, if we give you access, you'll surf the internet all night. I'm like, really? I'm trying to help patients who need my care. And I think any barrier that has a good intention, perhaps, that impacts the way we look after patients, makes no sense, needs to be revisited immediately. Yeah, absolutely.